Misunderstood here at the clinical pathology receiving at De Worst Vet Teaching Hospital with Dr. Diagnosis, the leading pathologist here at De Worst University. Diane has been studying Aleutian disease for many years, and we are hoping she can shed some light on the situation with Wally. Tell us a little about this deadly disease that Wally has contracted.
Well, misunderstood. Aleutian disease is the name given to a specific species of the Parvoviridae family. Specifically, its taxonomy is the family Parvoviridae, the subfamily Parvovirinae, in the genus Adenovirus, and the species is Aleutian disease virus. For Wally, the species is likely Aleutian disease virus strain F. There are 3 common strains we know of, you see. There's Aleutian disease virus strain Utah, which is assumed to be the original virus strain, and is more virulent in the mink, with the recessive Aleutian gene. Then there's Aleutian disease virus strain F, which is specific to our ferret friends, like Wally. And Aleutian disease virus strain G, which is non-virulent, and we use it in laboratory testing and studies on the virus.
How is Wally a target for a virus that originates in mink?
Current research suggests that ADV strain F originated through the mutation from an original mink ADV to become infectious in ferrets. Since ferret and mink farms are fairly common in Utah and other affected areas, it's plausible that the mutation crosses the species barrier through a continual contact. Aleutian disease virus strain F is not, however, as pathogenic as the mink strain.
And why is that?
In mink, there's a homozygous recessive gene that affects fur color, making them blue, which is called Aleutian. It is linked to a gene responsible for the impairment of lysosomal activity in granules-producing cells. This is called Chidak-Higashi syndrome, and it prevents phagocytes, such as macrophages, from being able to degrade their targets appropriately or fully. Aleutian disease virus targets macrophages and dendritic cells for its replication cycle, typically in the liver and the lymphoid tissue. The inability to completely lyse and phagocytose their material, coupled with the hypergammaglobulinemia that characterizes the disease, results in a deposition of antigen-antibody complexes that eventually deposit in the organs and cause other signs that we're seeing in Wally.
Can you explain the blood test that you ran for the veterinarian on Wally and what they mean?
Surely misunderstood. The normal BUN level for a ferret ranges between 8 and 37 milligrams per deciliter. This test is measuring the amount of urea nitrogen in the blood. Typically, the liver produces ammonia when it breaks down proteins that have been used in the body. Ammonia combines with carbons, hydrogens, and oxygens to form urea, which travels through the liver and is generally filtered out, given to the kidneys, and excreted from the body through urine. A high BUN level indicates kidney dysfunction, high protein intake, or inadequate fluid intake. Wally's blood gave us a BUN of 50 milligrams per deciliter, which likely indicates a moderate to severe stage of renal failure, because of the previously mentioned immune complexes that are being deposited in his nephrons. I also believe that his renal cells are experiencing lymphocytic infiltration, which is the cause of inflammation and impairment of the organ's function. I also ran a blood creatinine level test on him. For a ferret, the typical range is 0.16 to 0.84 milligrams per deciliter. Creatinine is a waste product from the muscles that is filtered out of the body by the kidneys through the glomerulars. A high creatinine level also indicates renal dysfunction. Wally's blood tested high with a result of 1 milligram per deciliter. The result is consistent with the conclusions from the BUN test. Finally, I tested Wally's blood for a total protein level. For a healthy ferret, this test should yield a result between 4.4 and 7.3 grams per deciliter. Wally's blood indicated 10.6 grams per deciliter, which is elevated. A high total protein result indicates chronic inflammation or chronic infection, Considering Wally's other results, this also supports the idea that Wally was assaulted by that criminal mastermind, Aleutian disease virus.
What other tests are you planning to run to confirm the diagnosis of Aleutian disease so that we have an undeniable evidence when this criminal is finally behind bars?
Well, the best test I can run for the presence of Aleutian disease virus in Wally's body is to take the antigen with a negative charge and place it into a well cut into a layer of agar gel near a negative electrode. Then place his blood serum with a buffer in a well near a positive electrode. When the charge passes over the gel, the positive charged antibodies will flow towards the negatively charged antigen, and the antigen will flow towards the positively charged electrode. They meet in the central zone, and the complexes that form will deposit on the line in the gel. If there is a straight or slightly arced line, we can conclude that Wally definitely has Aleutian disease virus. This is called a counter-immunoelectrophoresis test. We can also perform a DNA in situ hybridization test using a PCR-generated viral-specific probe to localize the DNA in the tissue sections. This would best be used in tissue samples from the liver, the spleen, the lymph nodes, or the kidney. Ultimately, the best diagnosis would be biopsies from Wally's kidney, liver, intestines, spinal cord, and bladder. We can also do a PCR, but many cases of Aleutian disease virus are only confirmed post-mortem.
Is there any vaccination for Aleutian disease?
Currently, no. There's no treatment. Once a ferret or mink comes down with the disease, it's anyone's guess if our culprit will be successful. Children, they hardly stand a chance. Since the criminal begins behaving like the others of his Parvoviridae family, interstitial pneumonia is caused by a rapid replication of the virus in the type 2 alveolar cells of the lungs. Kids infected with this virus basically never survive.
Thank you, Dr. Diagnosis. Back to you, Ron Walsh.